Hi, everyone. I'm Gabby Reithmiller from the Riley social media team. And today we're joined by one of our infectious disease doctors, Dr. Samina Bhumbra, who's also the medical director for infection prevention at Riley. Thank you so much for being with us today.
Yeah, no, thank you for inviting me, Gabby. This is a pleasure, and it's definitely helpful to get the word out.
So, what I want to start off with today is having you paint us a picture of what's unfolding inside the hospital when it comes to the patients who are showing signs of these respiratory illnesses right now.
Yeah, so between the patients that are coming through the ER as well as those that are admitted, we are seeing a decent amount of respiratory viral illness that patients have. And so when it comes to what kids are being admitted with, we do have, unfortunately, a decent number of children that are being admitted who are very sick and requiring care in our ICU due to respiratory illnesses.
And so, what are these illnesses? A lot of times, as parents, we know, okay, going into the winter, flu is going to be top of mind. Is
Mhm.
that the main concern right now? Can you give us a little
Yeah,
bit of idea of that?
yeah. So flu is starting to peek its head out in the community. We are starting to see a couple of cases of influenza. There's two big types of influenza. There's influenza B, there's influenza A. And so we're starting to see a couple of each pop up in our testing. But the big culprits right now are some old favorites. And I say that tongue in cheek, but RSV or respiratory syncytial virus, as well as most likely enterovirus. I say most likely because our testing we use to detect these infections with only reports it as rhinovirus, enterovirus, but we know across the country that enterovirus, specifically D68, is a version of the virus that can cause severe respiratory illnesses in children.
And so these little kids, a lot of times through school, it's common for them to end up with a virus. But what leads to them needing care at Riley, particularly even in our ICU,
Yeah.
when it becomes that serious? Can you describe kind of what you're seeing in those patients?
Yeah, so I think of usually three general groups of patients who are most at risk for viral illness or for kind of viral illnesses or kind of downstream effects of those viral illnesses. So the first group that comes to mind are our infants, or especially our children that are under 1 year of age. They're the group that is most susceptible to RSV, and they're the kids if they are infected with RSV, it can cause bronchiolitis or inflammation of their airways and lead to difficulty breathing. The next group I think about are the kids who have weaker immune systems. So these are kids that may have undergone a transplant or kids that are battling cancer and are receiving chemotherapy, for example. And so in that group, even though maybe they've seen these infections in the past, their immune system may not be currently strong enough to fight it off. And then the last group is the group where you may have healthy children who get the virus and usually overcome the virus, but if they don't, it can sometimes lead to bacterial pneumonias, for example. And so those are really the big three that we think about and that we're trying to protect during the respiratory virus season.
And so sometimes when I walk through our PICU, our intensive care unit at Riley, you hear terms such as ventilator or ECMO. Are these tools that are sometimes necessary for these types of patients as well?
Yeah, unfortunately, that is the case. So, especially with RSV, we don't necessarily have a true treatment to treat the virus. We have to support the kids with what you mentioned, with helping them breathe with the ventilator, or sometimes even giving their lungs a break entirely by using ECMO, and letting the machine do the breathing for them until their body can heal from it all. And with that in mind, too, there are a lot of viruses that we don't necessarily have a treatment directly for. The ones that we really do have treatments for are COVID or SARS-CoV-2, and then influenza are really the two where most patients, if they get it, they may have a treatment available for them.
Okay. And so, how much of an increase, I guess, are you guys noticing just anecdotally when you're talking to the other infectious disease doctors or perhaps our PICU doctors in just the volume of kids coming in with these conditions? We don't have to get into, the details of the numbers, but just overall.
Yeah, and I think as I've thought about it this last week, it's almost a perfect storm situation. Ever since COVID showed up, it really disrupted the scene with other respiratory viruses when it comes to the pattern of when they show up. Traditionally, we think of fall and winter as respiratory viral season. Usually at this time of the year, we're starting to see RSV pick up pre-pandemic. But in the last couple of years, we've seen RSV pop up sooner. For example, last year we saw RSV show up in June, which really caught people off guard. This year, again, RSV was present through the summer, and it is still on the uptick. And so we are seeing RSV on the rise. We're seeing enterovirus most likely right now, and this is the time to see enterovirus, late summer, early fall. And then that compounded with kind of other things that are, of course, going to happen every day to children, unfortunately, for other illnesses. And so it's just, like I said, the perfect storm of just different illnesses that happen to overlap at the same time this year that are just leading to a larger volume of patients being admitted with these illnesses.
Okay. And so if a parent is watching this, they've maybe got kiddos in school or daycare, and they want to be just prepared in case they encounter one of these viruses, what should they do if their child is displaying perhaps a really bad cough or even some labored breathing? How do you decide, okay, I need to go to Riley or I need to contact somebody else?
So I think you said one of the key things there, labored breathing. If your child is having trouble breathing, that's an immediate sign to come to our ER for further help, because that means your child is not able to breathe on their own, and they're not able to they'll need our help essentially. The other reasons too is sometimes when children have to breathe that fast and they're not feeling well, they're not able to stay hydrated. And so that's another reason to come to our ER for further evaluation and perhaps IV fluids in that situation. I would recommend against coming to the ER just to have a test done if your child has just some light symptoms or a fever for a couple of days, because it's going to put themselves at risk for more illness that may be unnecessary. Ultimately, at the end of the day, there are other things that parents can do to help limit as much as they can illnesses to their kids. So first thing, of course, is the general practice of washing hands, especially after touching common objects, so like doorknobs, table surfaces. And I think with COVID, we got into a really good habit of washing our hands, and that's something that I hope to see continue, whether it's with water and soap or with sanitizer. But either way, either method can help kill most viruses. The other way is by vaccinating your children as well as yourselves. And the two vaccines that come to mind are influenza, as well as the COVID vaccine. And both of those are now available for 6 months and older. And these are two great ways to help prevent, if not decrease, illness. And so sometimes, even though people may still get the flu after getting the flu shot, we know that the severity of the flu is far less in those individuals who get the flu shot than those who don't. And by severity too, I mean, that's going back to those pneumonias, going back to those individuals that may develop a bacterial pneumonia after flu, for example, and need that ventilator or need ECMO to get through it.
Yeah, all really important tips to keep in mind as we get into these fall, winter months for sure. So, thank you so much for taking the time to shed light on what's going on within the halls of the hospital. And we appreciate all the work that you guys are doing.
No, thank you, Gabby. And also, I think just I hope that families understand that your providers are definitely thinking about your children. It's just an incredibly busy time, and so to give us grace during this time period is really appreciated.
Yeah, for sure. Well, thank you.
Thank you.